the Osteophysic YouTube channel. Today we're going to be talking about why am I getting pain in my toes. So pain or soreness or tenderness around the feet and the toes are incredibly common, and we get lots of people coming into clinic presenting with a variety of different symptoms around this area. So I was kind of thinking what conditions would be really cool for us to cover today. So I'm going to talk about 3 different conditions that we might see in clinic, how to manage them and what you can do to treat them. Number 1 is probably a condition that most of us must have heard about, and this is gout. So a gout is an acute inflammatory joint condition triggered by high levels of monosodium urate crystals forming in the joint, and this is due to higher levels of uric acid in the body. When we get hyperuric acidemia, so getting that in the blood, those higher levels of uric acid, that can be from lots of different causes. So we develop or we produce uric acid from our liver, we also produce it from the intestines, we also produce it from the endothelium of the vascular structures, as well as the kidneys being involved in terms of filtering that out of the body. So if any of these symptoms are out of balance or there's something wrong with that area, that might trigger or possibly be a cause for gout. So what are some of the risk factors of gout? So anybody experiencing high blood pressure, diabetes, any cardiovascular conditions, it can be linked to dietary changes as well. All of these different factors can come together to predispose someone to have a higher risk of getting it. How it typically presents, well, most people know about it if you're struggling with gout. It tends to be monoarticular, means that it's occurring in one joint. Although it can occur anywhere, it's most common in the big toe. Because you've got crystals forming in the joint or within the joint surfaces, it really aggravates the area. So it's red, it's hot, it's swollen in that joint, and it can become incredibly tender to touch. Typically it can either build on up over time, but the acute response is quite sudden. What we would recommend and what we would look at in clinic, because some people do come in to see us if they're struggling with joint pain around the big toe, you normally can see from the skin changes that we need to refer on. So the first thing that we would do if someone's coming in with suspected gout is send them straight back to the GP, get the GP to have a look at it, measure all of the key stuff, make sure they can work out what might be predisposing the gout symptoms in this particular individual, maybe changing lifestyle factors or treating the cause of the symptoms, and then getting them back on their feet. So the second condition we're going to be talking about is Morton's neuroma. So that is an entrapment of your plantar nerves, the nerves underneath the foot, supplying different areas in between the toes and underneath the toes. It can either be triggered from pressure, like I said, directly on the nerves underneath those plantar nerves, or from repetitive traction, so pulling of the nerves underneath the metatarsal ligament. How people typically represent in clinic if they're coming to see us is any direct pressure over that thickening around the nerves, around the plantar nerves, typically between the second and third toes, so the tarsals. It's normally really painful and weight bearing. It tends to feel a bit different, so like numbness, dysesthesia, burning, tenderness that you would expect if we were pinching the nerves or entrapping the nerves, and a lot of people explain that it's just incredibly uncomfortable. What we would look at in clinic if someone was coming in to see us, of course we would assess the whole foot. You want to rule out any other differential diagnosis, so plantar fasciitis or any damage to the other joints around the area. What we would then look at is something called a positive squeeze sign, so you would squeeze the toes together to see if that can reproduce any kind of tenderness or pain. You would also want to have a look at palpating and pushing around the area to see if that reproduces any pain. Normally what you find on examination is there doesn't appear to be any kind of joint deformity or any obvious signs. So majority of the time, once you've done a full neuro screen and you've assessed everything, so you've checked all the nerves into the feet, what you would do is obviously send for further imaging to make sure there's nothing else going on, so any other differentials like a stress fracture, stuff like that, confirming the diagnosis of a Morton's neuroma. What they would then do treatment wise, they would look at a couple of different things. So in terms of research, manual therapy might not be the first options for a Morton's neuroma. You might look at that later to help with the mechanics, but initially they would look at stuff, for example, like orthotics, possible corticosteroid injections around that area, shockwave, lots of different stuff they would look at to take down the inflammation, take the pressure off. But the most important thing, if that is your differential diagnosis, is having it assessed properly, sending for imaging, confirming the diagnosis, and then speaking to the specialist about the next steps for you. So the third condition that we're going to be talking about is metatarsalgia. So all that fancy word means is pain in the metatarsal phalangeal joint, so the joints at the lower part of the foot. And some of the most common causes is stuff that we've spoken about already, so it could be triggered with Morton's neuroma, sesamoiditis, which is inflammation of the sesamoid bones underneath the big toe, could trigger a change in mechanics. It can be also altered or can be triggered by pain in the metatarsophalangeal joints themselves. If we've got any wear and tear or damage, can trigger pain into these joints and bones. So what are some of the lifestyle changes that could trigger metatarsalgia? So a really common one is if you repetitively change the mechanics of the foot. So potentially if you're wearing high heels for long periods of time during the day and you're extending up through the foot, this can put a lot of pressure into those metatarsal phalangeal joints. It could also be due to tight fitting shoes or anything that's squeezing the foot together might be triggering that pain. It could be due to the mechanics or the activities that you do, so anything repetitively over time. So if you're a runner or any high impact sports and maybe you've changed the duration, frequency or intensity suddenly, that can cause pain and soreness into this area, as well as changes in your arch mechanics and the foot mechanics. So if you've got any instability, so potentially you've had like an ankle strain before or a previous injury, that can predispose pressure through certain joints. It could also be due to, like I said, if we've dropped those arches or we've got excessively high arches, that might change the mechanics. So if you're struggling with pain in the metatarsophalangeal joints or over those tarsals or metatarsals or phalange bones, what we then want to have a look at is ruling out any additional injuries, so any kind of stress fracture or severe kind of wear and tear or deformity into the joints before working out what might be causing the pain. So we need to see what's going on initially, so whether that's x-ray, speaking to an expert to kind of get that diagnosis, and then causing and creating a management plan from there. So obviously we have covered 3 conditions today. There are lots of other causes that can cause pain into the toes. So depending on the response from the video, and if you guys have any comments, of course we can always do a part 2 of what's causing pain into my toes. So this is where we might explore bunions, sesamoiditis, osteoarthritis of any of the toes, particularly the big toes, hallux valgus, you know, all of these different things we can dive into next time. But like I said, hope you found the video really useful today. Any questions, please comment below, and look forward to seeing you on our next video.